the last panelist, which is, I believe, a very important topic for all of us to see the other opportunities that are in store for the healthcare industry. We will have with us the Board of Investment Executive Director, Ms. Maria Corazon Dichosa.
Good afternoon, and thank you for inviting the BOI to this webinar. For those who are not very familiar with the Board of Investments, we are DTI's lead agency responsible for industry development and investments promotion in the Philippines. We take the lead in the promotion of investments, assist Filipino and foreign investors to venture and prosper in desirable areas of economic activities, and we register qualified activities under the relevant Investments Priorities Plan, or the IPP, and administers incentives to compliant registered projects. Now, the basis for the qualification as well as for incentives availment in the BOI is the Investments Priorities Plan as mentioned earlier. Currently, the prevailing IPP is still the 2017 IPP. And we have actually listed here 10 investment preferred activities. But for this afternoon's topic, the relevant of which would only be number 4, healthcare services, including drug rehabilitation, and number 7, innovation drivers. Now, for healthcare services, this covers the establishment and operation of general and specialty hospitals and other medical healthcare facilities, including drug rehabilitation centers. Any of the following may qualify for registration. So general hospitals, levels 1, 2, and 3, in any of the locations listed in the Annex C1 and C2 of the IPP, and specialty hospitals as well as other medical and healthcare facilities anywhere in the Philippines outside of Metro Manila. For the definition of general hospitals, as well as the coverage of what are general hospitals, specialty hospitals, and other medical and healthcare facilities, these are actually defined in the IPP as well and made in accordance with the DOH administrative order. Now, only revenues derived from medical and diagnostic services rendered by the registered entity shall be entitled to ITH, and any income from lease or rents and revenues from any other non-treatment related services will not be eligible for ITH. Now, prior to start of commercial operations, the registered enterprise must submit the license to operate or accreditation or certification, whichever is applicable, issued by the Department of Health. And prior to availment of ITH, the registered enterprise must submit a copy of the Certificate of PhilHealth Accreditation wherever applicable. Now, for the other one on innovation drivers, there are two activities that are preferred here. So one is research and development, and this covers all research and development activities and the establishment and operation of facilities for the conduct of clinical trials, including drug trials. This would be the contract research organizations, or the CROs. So for example, the CROs that would conduct clinical trials, for example, for the COVID drugs like remdesivir, or for example, the COVID vaccines, this would be qualified for BOI registration. Now, the registered CRO must submit a copy of permit to conduct clinical trials from the FDA before the conduct of each clinical trial. Another activity would be Centers of Excellence, and this covers the establishment of institutions specializing in technical education and training in various disciplines in Centers of Excellence or Centers of Development. For the healthcare sector, this could be, for example, centers for cancer treatment or centers for heart disease or maybe eye and other specialties that we may need to develop in the country. Now, the application for registration must be accompanied by an endorsement from the CHED or other government agencies that would be relevant to the application. Now, also very important for us to understand is the project type and status of what would be applied with the BOI. So as to project type, that could be new, expansion, or modernization and rehabilitation. For new projects, this could be new entities, for example, projects of companies newly incorporated with the SEC, or it could be existing enterprises who would do new undertakings, separate or distinct from the existing activities. So, for example, if you're having a pharmacy operation, then you would like to establish a hospital, then that hospital would be considered as a new project. Or, for example, you have a new hospital, say in Quezon City, and you would like to establish another hospital in Batangas, then that new hospital in Batangas would be considered as a new project. A project could also be expansion, and this would be by existing entities who would like to, for example, a hospital. Uh, there would be additional beds or additional wings to that existing hospital, then that would be treated as an expansion. And then if, for example, you want an existing hospital to be modernized, like you would like to replace the equipment with new and advanced equipment, or you would like to renovate the building because it's quite old and dilapidated, and you would probably install some IT processes or technology in the hospital, that could also be considered under the modernization. Now, as to status, that could be pioneer or non-pioneer. For pioneer, that would be for hospitals or healthcare services, that could be the application or the use of new technology, new treatment, or new processes that are not yet being done in the country. Or it could also be the third category would be services activities for the attainment of national goals as predetermined by the BOI board in consultation with the relevant agency. But for this last category, we don't have a specific program that has been predetermined by the board. But if you have any ideas, you could probably inform the board and we can probably do the necessary consultations. And of course, anything that's not pioneer would also be now falling now under the non-pioneer status of the project. Now, very important to determine the project type as well as the status, because that is where the period of incentives will be dependent upon. So in the case of income tax holiday or the ITH, if the project is new and pioneer, that will be 6 years of ITH. And also if located in a less developed area, as identified also in the IPP. But if the project is new and non-pioneer, that will only be 4 years of ITH. And if expansion or modernization, that will now be 3 years of ITH. Now, there's also the duty exemption on imported capital equipment, spare parts, and accessories. So this is available to all registered enterprises, regardless of whether new, expansion, or modernization, or pioneer and non-pioneer. So if you have, for example, hospital equipment or testing equipment that you need to import from outside, then you can actually avail of the duty-free or the duty exemption on these importations. And then, of course, you can have employment of foreign nationals and the simplification of customs procedures. For example, if you have these importations that you need to do for your operations. Now, the date we have for the period 2010 to June 2020, we have registered around 23 facilities. So 23 hospital facilities and 2 medical tourism facilities. These 25 projects account for 12.99 billion pesos of investments in healthcare facilities. And for 2020, we were able to register 3 to date. So that would be San Mateo Kidney Care and Dialysis Center, and the Riverview Medical Center, and the ACE Medical Center in Dipolog. So these healthcare projects or hospital or facilities have added 2,026 hospital beds. And because of the dispersed location of these hospitals, of course, there is that improved access to healthcare facilities for Filipinos. And of course, in terms of employment, that has added around almost 5,000 jobs to the healthcare sector. Now, for those who already registered with the BOI, the board has adopted this policy on ITH suspension. So for registered enterprises that have not been able to commence commercial operation for projects that are still on pre-operating stage, you're actually you actually have two options. One is to cancel your registration because you think you will not be able to start on time, and that maybe even if you start, you won't be able to optimize your revenues. So you can cancel your registration without prejudice to reapplication, provided that the activity is still listed in the current IPP at the time of application, and or you can actually request the BOI to move the start of commercial operations so that you do not forfeit any of your ITH year, because you think even if you start right now, you won't be able to optimize the revenues for your operations. So this would be for those who have not yet started commercial operations. Now, for those who have already started operations and was forced, for example, to suspend operations or to uh, was affected, adversely affected by the pandemic, you can actually apply for ITH incentive for taxable year 2020. You can continue that one, or you can actually defer your ITH incentive availment for a period of 1 year or corresponding to the duration of the operation. Your operation has been affected or disrupted. So you can actually not avail it for 2020. You can actually avail that ITH year for taxable year 2021. Okay, provided that if you do that, you will have to pay whatever is the tax due to the BIR for 2020. And that if, for example, 2020, and you will defer that, is your last year of ITH availment, then if you defer that to 2021, it will not be the whole year of 2021, but it will only be as to the remaining period or the months of ITH entitlement that you are supposed to enjoy had you enjoyed it for 2020. So that is only for those already registered with the BOI. Now, I mentioned earlier that the prevailing IPP is still the 2017, but just to inform that we have already submitted draft 2020 IPP to the Office of the President last May. And what we have there is a carryover of the 10 activities I showed you earlier, but we also added another activity there that says all qualified activities relating to the fight against the COVID-19 pandemic. So this covers the production or manufacture of medicines, medical equipment and devices, PPE, surgical equipment and supplies, as well as laboratory equipment and its reagents. And then it also includes production or manufacture of raw materials, machinery and equipment for use in the production or manufacture of the aforementioned products. So this also includes repurposing of manufacturing activities to produce the said goods or services in the fight against COVID-19 pandemic. And with that qualifying as a pioneer project, it was also recommended there that activities under this listing of relating to the fight against COVID-19 would be entitled to ITH of 6 years. Now, even without the 2020 IPP, maybe a lot of you will have known that the BOI or the DTI has been very active in advocating for a lot of health-related initiatives, particularly recognizing the difficulty in sourcing a lot of our PPEs for our healthcare workers. So we started with the repurposing initiative, and this was to address the current requirements of the country's healthcare system and the general public for COVID-19 critical products. So we ask our electronics companies as well as our garments manufacturers to do masks and coveralls that will be used by our healthcare workers as well as the other frontliners. It was also to establish and deepen the country's supply chain in the manufacturing of healthcare products to a certain level of self-reliance, because we noticed that a lot of the countries actually imposed export bans, and so we had difficulty accessing supply of these important PPEs. And of course, since a lot of businesses were affected by the pandemic, we also encouraged repurposing to revive idle or help low utilized facilities increase their capacity utilization, and hopefully retain jobs in the manufacturing sector. Another initiative that we had is the PPE Ecosystem Initiative. And this is where we had a lot of collaboration and coordination with our repurposing companies from the electronic sector, from the metal sector, from the garment sector. And there they met and agreed to produce what we needed to fight against COVID. So this initiative was to sustain the local production of health critical goods and expand manufacturing base, to reduce dependence on imports and mitigate any impact of export bans by the source countries of these PPEs, to address the supply chain gaps in the manufacture of health critical goods. Of course, for our local manufacturers, it is also important that we try to help them source the raw materials and supplies for them to make the PPEs. And also to improve the regulatory environment. So we do a lot of coordination with the FDA and other concerned government agencies. So we try to facilitate the permittings and licenses of our repurposing companies. And then, of course, there was the Bayanihan 2, which provides for the accreditation of companies who are into the manufacture of PPEs and other goods needed to fight COVID. And we accredit them so that they can avail of business tax exemption as well as taxes and duties exemption from any of their importations. So this is under the PPE Ecosystem Initiative. Third will be the domestic preference. So we have mentioned the companies who tried to answer or heed the call of the government for the local production of the needed PPEs for healthcare workers and frontliners. So now they have produced, and we need to help them also providing a ready and steady market. So we have this domestic preference initiative as well. So as mentioned earlier, this is to provide a ready and steady market for those who repurposed, particularly those who repurposed early on at the start of the pandemic. Also to support local manufacturers and maintain jobs, if not increase the jobs for the manufacturing sector, to ensure the quality and compliance with standards of health critical products supplied to our hospitals, healthcare workers, and other frontliners. And of course, again, the Bayanihan 2, which provides for the certification of non-local availability. So meaning for those products or PPEs that are locally manufactured already, there is now the support from the government, and therefore we will only allow importation of products if they're identified to be non-local available in the country. And of course, we have the strategic stockpiling. We have this to ensure a ready and steady supply of health critical goods supplied to our hospitals, our health workers, and other frontliners. And of course, also to mitigate impacts of any export bans that may be imposed by source countries of health critical goods. So at any time that any of our hospitals would need these PPEs, we're assured that there is supply because of this strategic stockpiling initiative. And then, of course, in terms of vaccine development, including the clinical trials, the DTI is a member of the sub-TWG on vaccine development, led by the DOST. And in there, we do bilateral cooperation with vaccine developers for the conduct of local clinical trials and possible local manufacturing. We have finalized the procedures for a facilitated approval of clinical trials, so we get to deploy the vaccines as soon as we can. And of course, we also try to meet with local pharmaceutical companies to encourage local manufacturing of vaccines in partnership with the developers. And lastly, of course, vaccine procurement, very, very important. The DTI is also a member of the sub-TWG on vaccine procurement, which is led by DBM. And in there, we try to work on the budget requirement for the vaccines purchase so that whenever the vaccines become available, we will be able to provide the funding so that we get to access whatever is available in the market. And then, of course, coordinating with the local logistics and cold chain companies for distribution and handling requirements of the vaccines. So that if, for example, we get access already from the vaccines, we will be able to already dispatch the vaccines in accordance with the handling requirements of the said vaccine, which could range from positive to negative 20 or even negative 70, as you will probably have heard from the news. So this is actually my last slide, and I think we have informed you of what we have been doing in the BOI and the DTI to help the healthcare sector against this in the fight against COVID. So if there are anybody who would like to register with the BOI, we'll be happy to help and assist you. And Ms. Joyce Alumno has our contacts. So thank you for your attention, and have a good afternoon. Thank you.
HealthCore Academy, your reliable partner for world-class healthcare delivery and patient safety.